Getting regular medical checkups is not just a formality, it's a crucial safeguard in your effort to eliminate visceral fat. While lifestyle habits like diet, movement, and sleep carry enormous influence, there's another, often overlooked factor in the visceral fat equation: your internal biology. Hormonal imbalances, undiagnosed conditions, and subtle metabolic disruptions can all interfere with your body's ability to burn fat, particularly the stubborn kind stored around your organs. Visceral fat is not merely a cosmetic issue or a matter of eating too much. It's a metabolically active tissue that responds to, and worsens, hormonal dysfunction. If you're doing all the right things, exercising, eating clean, managing stress, and yet the fat around your midsection refuses to budge, it may be time to look under the hood. That's where regular medical checkups become essential. Conditions like hypothyroidism, for instance, can quietly sabotage fat loss by slowing metabolism, increasing fatigue, and promoting water retention, all of which make it harder to move, burn calories, and mobilize stored fat. Without a proper diagnosis and treatment plan, usually involving thyroid hormone replacement, no amount of dieting will correct the issue, and visceral fat may continue to accumulate. Polycystic ovary syndrome, PCOS, is another common but often underdiagnosed condition that affects fat distribution, especially in women. Driven by insulin resistance and androgen excess, PCOS can increase abdominal fat storage even in women who appear lean elsewhere. Managing PCOS with medical guidance, which might include metformin, hormonal regulation, or targeted lifestyle changes, can dramatically improve insulin sensitivity and reduce visceral fat over time. Other conditions that contribute to visceral fat gain include Cushing syndrome, excess cortisol, type 2 diabetes, fatty liver disease, sleep apnea, and even certain medications like corticosteroids or antidepressants. If left untreated or unmanaged, these conditions create a biological environment that favors fat storage around the liver, pancreas, and intestines, and elevates your risk for heart disease, stroke, and early death. Routine lab work can also reveal hidden drivers of visceral fat. Elevated fasting insulin, triglycerides, liver enzymes, or inflammatory markers like CRP or IL-6 can all indicate deeper dysfunction. Catching these warning signs early allows for more precise interventions, such as switching medications, optimizing hormones, adjusting macronutrient ratios, or treating underlying inflammation. There's a psychological benefit, too. Knowing that you're not failing but facing a physiological roadblock can shift your mindset from self-blame to empowered action. And when you work in partnership with your doctor, using medical data alongside lifestyle changes, you can create a targeted plan that works with your biology, not against it. But the warning here is serious. Skipping medical care or assuming everything can be fixed with willpower alone can be dangerous. Visceral fat isn't just about aesthetics. It's a high-risk warning light for cardiovascular disease, insulin resistance, and cancer. Ignoring persistent belly fat without screening for deeper causes can delay diagnosis of silent but deadly conditions. And early intervention, in many cases, makes all the difference. Medical checkups should be routine, not reactive. Aim for annual screenings that include a complete metabolic panel, lipid profile, liver function tests, HbA1c, thyroid panel, and hormone levels when appropriate. If you're over 40, overweight, or have a family history of metabolic disease, these evaluations are not optional. They are essential for prevention. In the end, reducing visceral fat isn't just about looking better. It's about surviving longer and thriving healthier. But without regular health monitoring, you're flying blind. Medical checkups give you a roadmap. They reveal hidden sabotage. They allow for personalization. And when combined with consistent lifestyle changes, they unlock the possibility of full, sustainable fat loss, not just under the skin, but deep within the core, where the most dangerous fat lives. So don't wait for symptoms. Don't self-diagnose. And don't ignore what your body might be trying to tell you. Get tested, stay informed, and work with professionals who can help you turn your hard work into measurable, lasting results. Visceral fat can be reversed, but only if you take a whole-body approach that includes what you eat, how you move, how you sleep, and what your labs reveal.